Hello and welcome to Pulse and Progress. This is a podcast that focuses on real stories and real conversations about issues and challenges, and most importantly, focuses on solutions and bold solutions that we as Africans should embrace towards some of the most critical issues that we face as a continent. And I'm really excited about today's episode, both as a mom and as a woman. Child survival across the continent is at a crossroads. And yes, there have been some great strides that have been made towards child care from a primary level. But we're asking, where are we currently? What are some of the gains that have been made? And what can we do to ensure that we do not backtrack on some of the advancements that have already been made? And with me today, I've got an distinguished I don't like to say panel of experts. I feel like it's very panel-y and very conference-y. I've got some experts who will be exploring these conversations with us as we also try to find out what are some homemade or African-made solutions, or what's on the table that we can already build on. I'd like to introduce Thoko Elphick-Pooley. She's the Deputy Director, Program Advocacy and Communications at the Gates Foundation, Africa. And her role at the foundation is to lead the Africa team's advocacy and communication strategy that helps to achieve the foundation's policy as well as the financing goals, both at a continental level and in key geographies. Thoko, thank you so much for making it to join us today.
Thank you for having me.
I'd also like to introduce Dr. Catherine Kanari, UHC lead at Amref Health Africa. Dr. Catherine is an expert at global health programming. And I guess a good place to start is just to look at the state of child healthcare and primary healthcare on the continent today, where we're at, what are some of the progresses that have been made. And, sometimes we look at the continent from a very... from a heavy lens, but there's a lot of progress that has been made in this space. Thoko, let's start with you.
Great. Thank you so much for making space for this very important conversation. I'm really thrilled to be here and joining Catherine for this conversation. So I just want to start by good news. Everybody likes good news, especially when we're talking about the area of child survival. More babies are living today than they did 25 years ago when the Gates Foundation was first established. In 2000, when the Gates Foundation was established, 10 million children were dying before the age of 5. 10 million children were dying per year. That's huge. If you look at the continent and you look at what countries have a population of 10 million, imagine an entire country being wiped out year in, year out. That's like such an unfathomable number when you think about it, because sometimes we can look at numbers and we hear these big numbers, but actually when you think about babies, 10 million babies dying. So this was in 2000. But progress has been incredible. And we really need to applaud leaders and partners for the great progress, because 25 years later, that number has been reduced by half. So it's incredible that that extraordinary progress has been made. And that's for babies. But you can't talk about babies without talking about mums, because for babies to survive, you also need mums to live. So in the area of maternal deaths, we've also seen great progress with a decline of 34% since 2000 in mums that have been dying during childbirth particularly. So this is really good progress. And I think we need to start there and acknowledge all the good work that has been done. Look at what those drivers for success have been and look at how can we duplicate that.
Okay. Thank you so much. And thank you for having me. So I'd like to reintroduce myself. So from the start, I am Samudi's daughter. So my mom carried me till the end. So for us to have this conversation, we also have to put ourselves in the picture, because we are part of those success stories as well. And so I am also a mother to 2 boys, and I'm also a story when it comes to surviving child survival and maternal surviving. Because when I had my last born child, had I been in a place where I did not have access, we'd have lost my baby and I would have been lost, because there were some complications that went on. So bringing that reality to the ground is that many people do go through this. survival, yes, but there's also the sad stories of the children that we're losing, the mothers that we're losing that are preventable.
What I'm curious about is why are we still losing that 50%? Thoko, let's start with you.
Yeah, I mean, listening to Catherine here, and I'm sure our listeners as well will identify that the things that we're talking about here are not rocket science. We're not talking about complicated solutions. We're talking about interventions that are really simple, cost-effective, and can be deployed and scaled up and more lives saved. One of the key drivers for success over the last few years, and I just want to talk about the great global solidarity that we saw. I'm sure you would agree that more babies surviving until the age of 5 is one of the least controversial things. Everybody agrees that babies need to survive. We don't even have to have a meeting, a declaration or something. Do you agree that we need to keep more babies alive? Absolutely, everybody agrees. And with that agreement came this incredible mechanism, which is called the Gavi for the Vaccine Alliance, where partners around the world came together and said, we are going to put money in. We are going to make sure that we understand that vaccinations are important to save children's lives. And we're going to make sure that there are resources. We're going to make sure that we have a system for procuring for all countries so that everybody gets these vaccines at the right price. And we're going to make sure that every child who needs these vaccines receives them. So this is the world, the global community working and acting in solidarity to save children's lives. So that's existed, right? And we've seen successes. But unfortunately, we are now living at a time when a conversation around should we put money to make sure children are vaccinated is no longer straightforward. You have countries that are saying, maybe not, maybe I don't have enough money, maybe I'll let somebody else do it. That breaks my heart completely. There are some things that we shouldn't even argue about, where we should basically say, let's just do it for everybody, for all the children in the world. So that ongoing and sustained commitment is something that really is needed. And this is where I think we're seeing backsliding in ongoing commitment on these non-controversial issues. You talked about nearly losing a child here in Kenya. I actually didn't think I could come back and live in Kenya again because on December 22nd in 2005, I lost a child. And so we're not talking about theoretical issues. You speak to so many women, they've been through this. They understand the pain, the agony of losing a child is, you cannot describe it. So then when I sit there and I find countries arguing about whether you could put money to save children, it's just
insane.
It's just, yeah, you could
insane.
call it that. It's totally insane.
Yeah.
So I think that's the first one, sustained political commitment at the highest of levels. Because actually in the Sustainable Development Goals, there is an agreement about where we need to get to by 2030. As the Gates Foundation, we are absolutely celebrating the halving of child deaths from 10 million to 5 million. But we want to even go further, have that in the next 20 years, because we think more babies should live. So my number one, we can talk about other things, sustained political will and sustained political commitment. And everybody who has power, who has authority, who has money, who is in a position of influence, completely committing that more babies surviving and living to the age of 5 is a non-controversial thing. It is something that we just have to do.
Thoko, you've raised an important point. And first of all, I'd like to say my deepest condolences. As a mom, I understand how difficult that can be. So I'm terribly sorry. You've raised the, you've talked about the political will and the political commitment And it's sort of taken me back a little bit to the first conversation we had on this podcast, which was an over-reliance on global funding. But I would like to look at this slightly different from what you've brought forward in terms of, we have the SDGs as a global a unit, so to speak, not as Kenya, not as Africa, but as a unit. What are some of the things that you think as a continent we can do to get that global unit to be more, and this is to both of you, to be more aware that this is not something we should actually, as you say, have a conversation about. Dr.
First
Catherine.
of all, my heart has moved.
Thank you.
Condolences. Same hospital I survived, and my child survived.
And many more babies survive.
Yes.
Yeah.
So condolences. But so back to the discussion, and I like what Togo has put in that segue of political commitment and leadership. And again, the buck stops with the financing. And for a long time, one of the key struggles we've had in the health sector is that the health people speak a different language than the finance people. And so some of those conversations are now beginning to happen, even at global level. You had a Gavi that doesn't speak to the financing side of things. It speaks to maybe the greater good, so supplying the vaccines. So when we look at how decisions are made, we have the financiers of the decisions and you have the technical people. And so one of the things that is amazingly now happening is that we are able as health experts to then give sort of dollar figures as to if you invest $1 in this initiative for health, what is the outcome? And that for a long time had eluded us, and we're still not yet there. Mm-hmm. However, with those conversations ongoing, we are then able to make it simple enough for decision makers and policy makers to then understand, and also for political leadership, because at the end of the day, what we're talking about is resourcing this maternal child health, and we're looking at investments in health for safeguarding that. And so that's one gain that we've made. The other things that we did as gains, and when I look at it from a physician point of view, is then ensuring that we treat this as, I'd say syndromic, for lack of a better word. You look at the 5 top killers, and you look at the interventions and package them in a way that if it's in a health service, it's in a health facility, the service provision is looking at that. So we call it integrated child management, getting the other word, ICCM. Anyway, it looks at integrated childhood illnesses being lumped together and looking at various treatment guidelines. And this is one of the things that made us successful so far. So most countries adapted this in the late 90s, including East Africa countries. And that helped at the facility level, decision-making and interventions to be fast. We also had a subsequent initiative where we are looking at the community-based interventions. How do we intervene at that level? So community health workers play a very huge role there. So capacity building them and kitting them, giving them the commodities to be able to sort out some of these issues, which are maybe as simple as ORS, oral rehydration salts for a patient who has diarrhea, a child who has diarrhea. For pneumonia, we have amoxil that's dispersible. So small things that you can do at community level, and then you can do them also at primary healthcare level. And so those have really pushed our gains, and those need to be sustained because they're working. The challenges we do have is then the resourcing, and maybe I'll let Togo get into that part. Looking at how are we resourcing, because we've, as you mentioned, we are so globally dependent on funding from donors. And so that made African countries not learn how to budget on a needs basis, because, this is already sorted. So we don't need to budget for, let's say, immunization or HIV and TB, for lack of better examples. And so now increasingly, we do need to then resource primary healthcare. And even the funding mechanisms are changing. We are now seeing a heavy push towards core financing, meaning that you need to put your skin in the game. These are your people. These are your communities. Why are we waiting for someone else to come and sort them out? You also need to put your skin in the game. And what is happening now is, even for example, cases like Gavi, there's a way that they had scaled how they will finance in some countries. Remember, some of the countries are now not lower income countries, they're lower middle income countries. That means you have a bit more resourcing. And so how then the funding mechanisms for some of these programs are going to work out is we're going to start reducing our dependency on a scaled version. For example, if in 2020 we received 100% support from Gavi, we need to figure out the next year how we'll receive 90%. So we need to put the 10% in. So those are some of the things that are then evolving in the geopolitical space, as well as in the health financing space, that we do need to be cognizant and push policies around. How do we increase our investments for health?
So as we go to our next part of the conversation around approaches and innovations, which you have begun to bring to the table, Catherine, how are countries, funders, and implementation partners and communities, which you have both alluded to, adapting to mitigate the impacts of the reduced funding cuts that we're seeing? Thoko, let's start with you.
Great. So as someone who has been a taxpayer in the UK for more than 20 years, paying a lot of tax for that matter, I was very happy for my tax to be put into these mechanisms that save life on the African continent. So I thought it was actually right for these countries. If you think about how big the diaspora community is in these G7 countries paying taxes, a lot of our nurses and doctors actually left the continent to work in these nations, and they pay taxes. So I don't actually buy this narrative that it is wrong to show solidarity to African countries for whom African countries have been some of the, I'm from Zimbabwe. If you count how many Zimbabweans are outside of the country paying taxes in these G7 nations, particularly, is quite huge. So I am very much in favor of global solidarity that recognizes what we call global public goods, where we agree that we have to act as a collective of nations and people to solve problems that affect even people outside of our borders. So I agree with that, and I'm a great supporter. I also accept that our African countries could do more than they're doing, particularly on health. There have been so many commitments that have been made on health financing, from the Abuja Declaration, where there was a commitment of a 15% that countries are going to be putting from their national budgets towards health, and many countries are still way below that. So I agree that there is some action that needs to be taken. I also accept that countries right now are struggling, even here in Kenya, under a heavy weight of debt. So even with the best intentions, realizing what we are talking about in terms of growing the health budget is complicated. So then maybe what we need to be talking about are the choices that countries need to make and how you protect life-saving interventions. We understand there are tough choices to be made. We understand countries are financially squeezed. We understand that the growing rise of the right in the Western world is really reducing what wealthier countries can do for poorer countries. So we're in a tight spot at the moment. Things are very tight. So when things are tight, even at the household level, you need to make choices. What are the things that we are not going to compromise on? And this is really the key message that we want to put out here, that we are not coming here from a lack of understanding of the financial situation, because somebody will say, hey, come on, like, which rock are you living under? Can you not see what's happening? We understand that. So here we are saying, when you have a choice to make, choose what saves more lives. Save under 5 children. Make sure that more under 5 children live. Now, why is that important for the African continent? People are our biggest asset. This is something that we have on our continent that many other countries are grappling with. If you look at the population projections by 2050, we are actually on the African continent going to be responsible for the world's labor force. Now, why are we then linking that to under 5 child mortality? The first 5 years of a life are so important. the development happens in those crucial 5 years. So if a child's growth is affected, stunting happens, and then your education attainment. In fact, the World Bank did a study which showed the link between stunting and education outcomes. A child who basically lacks the basic nutrition, lacks the development capacity in the first 5 years, is less likely to stay in school, is less likely to progress from one grade to the other, is less likely to complete, is less likely to progress to another, from primary to secondary school. So now if we are really looking at our people as our biggest asset on the continent, you will do everything possible to make sure that whatever we do, we protect this precious asset. We do everything to make sure that children live, they survive. What is needed to give them a fine start in life is protected. So I think this is what we are calling on, that as private philanthropy, this is what we're committing to. In fact, I don't know if you saw Bill Gates' announcement on the 8th of May, which was then followed up with this address at the African Union. Bill made an announcement that he is going to commit 200 billion of his wealth to the foundation, and that we will shut our doors on the 31st of December, 2045. But that we are going to double down on 3 primary goals, one of which is child survival and maternal mortality, the second of which is the elimination of infectious diseases, and the third, supporting countries through a pathway to prosperity. So from a private philanthropy perspective, this is a huge commitment that has been made. We recognize how important child survival is to the development of the continent, to the development of economies. And we are going to throw everything and the kitchen sink at making sure that more children survive.
I like where you've come from in terms of looking at the basics. We need these kids to survive. So when you look at innovation, you can look at it in different lenses, but I'll backtrack and go into a contextualized sort of framework. So why do we have disparities in the gains? Because even where we have gains, we still have disparities. And hugely, these disparities look at access, right? So access to quality service provision is really a critical one. And again, the funding then needs to go to that. We look at commodity and commodity security. And some of the things that we really need to then push for, and we've started, the good thing is we've already started, is this local manufacturing aspect that then makes us also dependent on ourselves and sustainable. Because at the moment, majority of the commodities we are even using in these programs are all imported. However, there are some gains. We have the vaccines that are being manufactured in Senegal. In Kenya here, we have a company that is doing even the basic syringes for vaccinations. So those are some of the innovations that we actually need to push to the fore and say, okay, look, we have X number of baths in a year. This is the commodity projection. How much can we start then doing by ourselves? And can we ask for support even from the West? How did you do it? How can we learn? So that knowledge exchange.
So if we look forward in terms of what strategies we can use, we've talked a bit about funding, we've touched on policy briefly. How can we reimagine what that space would be like, whether we're looking at systems and some of the implementation levels that you've brought out? Thoko.
So I think it's really continuing the drumbeat and reminding everybody that these issues are important. And when we achieve these great results that we've talked about, celebrating them and sharing that we're making good progress. So it's really important, because sometimes policymakers, we're very good as advocates of asking for things. And sometimes we do forget to celebrate good progress. And I think this is something we need to show, that actually that policy change you made delivered an outcome. More babies survived. Let's do more. So I think this is something else that we really want to thank all of the partners, thank all of the governments, including Kenya here, where great progress has been made, that those commitments, those policies that you signed up for delivered results. But we can't stop now. we can't stop now because we haven't. In fact, we're saying we can't stop at almost. We almost got there. We almost saved this other life. We can't stop at almost. So we really need to double down, stay focused, and scale up. So these tools that you're talking about here, these new innovations, Kenya is a hub for innovation. And there's some great innovations that are coming out here. Because actually, with everything is we did it this way 25 years ago and we achieved this result. The questions the foundation always asks is, can we do it better? Can we do it cheaper? Can we get it to more people than we did last time? And so how, like you say now, how do we harness the new tools, new innovations to make sure that 25 years ago, if you wanted an ultrasound, you needed to go to a fixed facility somewhere, maybe come to Nairobi, have an ultrasound. But now we have portable ultrasounds, which means that a woman can find out, oh, I'm having a breech, I'm having twins. Because sometimes women didn't even know they were having twins until they were at the delivery table. So how do we actually harness this technology, these new innovations? As the Gates Foundation, this we consider to be our most significant contribution that we can make. How do we find answers to problems that haven't been solved? And when that answer or solution has been found, how do we make it cheap so that it's affordable? Accessibility and equity is at the heart of everything we do. We don't focus on a technology that is not going to be accessible by somebody in Niger, in Mali, in Turkana. We want to think, okay, this is a great tool. And the biggest headache now is, how can we reduce the cost? How can we make it cheaper? How can we make it affordable so that it can reach more people? So if we can bring everybody on board on those things and just really commit to sustaining the gains, celebrate what's happened, but actually even focus more on what more we can do, scale up. We are committed. We are committed to that.
Thanks, Thoko. And in the spirit of bringing everyone on board, and I'm speaking as a layperson on this side, or putting on my journalist hat. In as much as clearly there's been a lot that has been done, there's a lot further that we need to go as a continent. But I'm curious, as a continent, do we have the capacity to actually handle this? Yes, that there's the likes of the Gates Foundation, that has shared their commitment for the African continent from that space. But we've got cuts from USAID, from the UK. Do we have the capacity to handle? Because I have a feeling we have no idea what those cuts are going to actually look like in the next couple of years.
Yeah, and we may start seeing that impact probably next year or sooner, because we are cognizant that these grants were supporting a critical, especially for primary healthcare. There is a huge gap that they were filling that we need to quickly figure out and prioritize. But I love what Thoko also said. We rarely celebrate. And for me, I'm a strong believer, if it's not broken, don't fix it. And so even as we look at innovation, we have learnings that we've learned from those 25 years. And as she's saying, we need to scale them up so that we get further than where we are. But those basics, again, there's technology and then going back down to the basics. So what you're asking around is, do we have that capacity? I mean, Africa has a huge capacity. We are the ones exporting our human capacity and running, as she said, in very many Western countries, many nurses, many doctors. And so, yes, we do have that capacity. But I think buckling down to the realities that Thoko mentioned earlier, what is our fiscal space? That's the key critical piece that needs to move. And for that to move, there's a lot of work around policy and advocacy that needs to be sustained. But I also like something you brought out around the political cycles and the interference of this, some of these gains. And so for that, I think even us as communities need to be the advocates for that. When you're going to the ballot, what are you choosing? What is the manifesto saying around health? Is it being actualized? And so are we being represented? So those are other factors that come into play when you're looking around then sustaining these gains, but also looking at the reality on the ground. So we do have the capacity, but we need to give it more resources and prioritize it more. As she mentioned, that health, I think in Kenya, we are maybe at 9% at best of our budget. Yes, as opposed to the 15%. And so, yes, we have seen steady improvement, especially during COVID. There was a great increase in health financing by the government. And I think we moved from maybe 4 or 5, and we are now steadily at around 9. But when we look at critically at this, we see that a lot is running human resources, so salaries and the skills. And so one of the hugest gaps is around, as mentioned before, commodities and issues around access and social protection, because you can have the best facility there, but if I cannot access it, it doesn't help me. So issues around social protection and issues around livelihoods are really critical around this conversation. We cannot escape them because they also are intertwined with other issues like behavior, intertwined with education, intertwined with the things that we are seeing within the political space. So we do have the capacity, we can deliver, but we need to sustain and protect what we've already done and then look at how we then also push further.
Yeah.
So, yes, Thoko. And if I can just jump in before you
Please do, please do.
Just in terms of safeguarding that progress.
Yeah.
And it's just the curiosity of what is stopping us from safeguarding that progress. And I'd like both of you to answer, then Thoko, you can join it with what you wanted to say.
Yeah. Again, do you know this is not impossible? One of the things that absolutely shocks me, even as we're talking about a tight fiscal space, is the fact that many, many countries on the African continent do not even spend the full budget which is allocated to health. That is something that where the mind boggles. I think it comes down to planning and it comes down to choices. What do you prioritize even with your resources? And I've had these conversations even with ministers and others. WHO hosted a session. At the beginning of the session, people weren't really sure what was being discussed. They actually thought that governments had allocated money to health, but they hadn't actually paid out. So it came up as a number which was allocated to health. That money hadn't materialized. That's why it wasn't spent. But no, it was actually money that had been fully allocated. So ministries of health do return unspent money. So what we're really encouraging countries is to invest in planning and budgeting. How do you plan? How do you budget? How do you choose the most important things? Sometimes, unfortunately, choices are made for procurement programs that take longer to actualize and money that doesn't get spent. But actually, if you can think, if we are saying as a country that child survival is the most important thing, what are the things that need to be financed out of the national budget? What are the things that partners are willing to support so that the country can make the right choices? My goal would be for countries to spend everything that is allocated to health. That would be amazing. If they can actually, if you speak to women, right? And women that look after a household budget, if they had X amount of money allocated to run a home, and if we had to have a meeting here and see how many of those women ended up basically putting the money back because they couldn't spend it, it just wouldn't happen. It just wouldn't happen. Like the idea that money is allocated is available and then gets returned. Because that makes it difficult when that Minister of Health goes back to the Minister of Finance the following year, says, I want an increase, because the advocates have been saying, you need to increase, you need to meet the Abuja commitment. And the Minister of Finance says, I'm sorry, that ain't happening because you're not spending what you have. In fact, we're reducing, we're not increasing because other ministries could be spending. So that, I think, would be an investment in some of those things. Prioritize public finance management, prioritize planning. Make use of these amazing brains that we have on the continent that can help
Absolutely.
with some of these things. Bring in the private sector to help with some of these these particular skills that altogether will lead to efficiencies of spend within the government. So our problems are kind of different, because sometimes we say the problem is lack of money. That is true in some cases, but in most times it's to do with simply inefficiencies, planning, and making the right choices. This is, I think, what I want to really drum up. Make the right choice. What are the things that have the potential to save more lives? Put money into them.
Maybe women should be in charge of public finance.
I mean, that will solve a lot of problems.
and it's so true. I get shocked as well. The process efficiency is a struggle. And you'll hear delays starting even with the disbursement, which leads to other delays in forecasting, procurement. So it's such a bad cycle. And I was actually shocked when I delved now even into county systems. The absorption of the funds that have been committed, there's always some sort of process inefficiency. And I like what she said around private sector. And some of those sustainability agendas need to also include the private sector and the great learnings that we can harness from that, even within the public financial systems. Because very simple things. You know exactly what is the birth rate in this your county, for example. So you can be able to say you'll need X BCG vaccine doses per year. So some of those, and I think what Togo is alluding to is then bringing those planners. It looks like health economists. It looks like people in finance who can help even with the budgets. Because healthcare workers tend to focus a lot on the technical. And that's what I said previously around it needs to come out as a figure. So for our vaccination campaign this year, how much are we going to spend, or how much do we need based on a certain projection, based on the numbers? The other key thing that then I'm alluding to is data. And we are really trying. But without that data and good quality data, we are dead in the water, even for that planning. So as she's mentioning, as a mother, I know I have 2 kids. So I know I have school fees for 2 kids. I have this. So in terms of then data, most of our African countries have not yet succinctly gotten it right, given that our context is very different from the West. In the West, you have a residential address. You're a taxpayer. Majority of the people are taxpayers, so you're able to be harnessed. So here, because our informal setup is larger than the formal setup, some of the struggles we have with data are around that. Again, the systems, because our facilities, are they tech ready? Do they even have a basic information system? We are trying to get there. I see Kenya making a lot of progress with trying to merge the data systems into one data highway so that we're able to get all our health data in one place. So that will really help, because it will help us in the planning, in forecasting, in procurement, even basic things as wages and human resources for health. How are they allocated? Is that you'll find, I was shocked sometimes when you do some of these studies, you find that even the employer is not clear where the healthcare workers are and their distribution. So you find this facility has no one nurse, this one has 10. And when you listen to the stories, it's interesting. The other bit I wanted to bring out is behavior. And human beings are interesting in behavior. So I'll put this context of, we did a universal health coverage trial in Kenya. And so one of the key indicators was around maternal and child health, skilled birth delivery. So I'll give this example because I really laughed. So in Africa or in Kenya, it matters where you're born. Actually, which hospital you're born. So we're busy here trying to say, we want you to access at your nearest health facility. But this woman in Nyeri is saying, my child cannot be born in this health center because this lady is from the community. I know her. She'll know me in another way. I need a sick role, because when I'm pregnant and delivering, everyone comes now to you. You have everyone coming to see you in hospital. And actually, even when you hear people saying where they were born, it's very interesting. I was born in a provincial hospital. Health centers and dispensaries, are looked down
Oh,
upon. So
wow.
human behavior is also very tricky around health seeking. Yeah. So when I said sick role, it means that this is the one time, maybe I've been Nyani, I work every day, but this is the one time I have downtime for people to treat me. So everybody will bring me things like
And they will not do that in the regular small healthcare.
Yes, I am the center of
clinic.
attraction.
That is
I need to travel. I need to travel back. So we found that some of the behavior issues around health seeking were really interesting. Yeah.
Interesting. I think that you'd find that in Zimbabwe too. And where people, just choose that my child has to be born in this particular location, this hospital, this name and everything. Yeah, that is very interesting. But if you can then improve services in all these centers so that everything is the same, it will hopefully take away from that. Because I think some of that is to do with the level of care that you receive.
Very true.
How, does this facility have running water? Does it have this? So, yes, women do want the best experience when they're delivering, when they're going to the hospital. So hopefully if we can focus on improving the health facilities, making sure you've got trained personnel, women will feel comfortable, right? So that's very fascinating.
So we're almost coming to a close. So 2 questions, and then hopefully one question that would be your takeaway, or the one thing that you would do to change the system if that ticket was given to you. But so if in your practice as you engage with stakeholders within the industries that you work with, are there some proven interventions that countries either have prioritized or should prioritize to ensure that every child has the chance to survive, to thrive, and of course to reach their 5th birthday? So I'm going to start with you.
So I will genuinely start with one that is really close to my heart. And as I mentioned, my experience, I lost a child that was dreadful, but I also almost died because of hemorrhage during delivery. So I want us to link child survival with lives of mums. And I'm sure many of you here have been to a funeral. It is one of the most heartbreaking scenes on a Saturday to go to a graveyard and find a young man cradling a newborn baby whilst burying his young wife. That scene, it is so common when you see a young man in his 20s, a new father, what is supposed to be the happiest time of their life, and then a newborn being a reminder of a loss, rather than looking at this newborn child and just being filled with utter joy. But then that joy gets turned into sadness, because every time you look at this child, you're going to be reminded that you lost the mom. And many women die from excessive blood loss during childbirth. I find that thinking about postpartum hemorrhage and looking at simple innovations, which is the drape, a recalibrated drape that actually measures how much blood a mom is losing. It doesn't have to depend on the eyes of a nurse looking at it and thinking, "Ooh, has she lost enough blood?" Or maybe that's not. Yeah, she can manage. But this actually just measures and shows how much blood a woman is losing at childbirth, and enables some very simple interventions to save a mom's life. If you can just think about saving the lives of moms, making sure that a mom has a safe and healthy pregnancy. You talked about anemia being one of the causes, but malaria being some other causes. That just means that a woman, when they're pregnant, they don't have good nutrition. They've got anemia. So the experience and the outcome of that delivery is going to be highly challenged. So if we can, I think for me, really thinking about that bundle and that package for postpartum hemorrhage for countries to save more women at childbirth is a really critical thing for child survival, because you carry a healthy baby, the outcome is going to be improved, but also a child needs their mom. Those first 5 years, the child having their mom is so important. So I think if we can invest in that, this is something that is so close to my heart. And this is one of the reasons that I'm attracted to working at the Gates Foundation and the work that we do, because we really address real issues, issues that affect real people, issues that can be solved, issues that we can all take collective pride that we did something. And the data will tell us. The data will tell us that we are in the right direction. So I want to be part of that. And I want to encourage everybody to join this movement for child survival, maternal mortality. It is within reach. We put all our effort together, we can achieve it.
I almost feel like I should wrap there. But Catherine, we'll come to you and then your final thoughts.
And I want to actually emphasize what she's saying because I'm a medical doctor, and in my beginnings, I worked in a district hospital. And let me tell you, that season, I think we were so tuned into maternal mortality. I remember in that particular facility, we lost, I think, 2 mothers in one day. And the Minister for Health appeared in our facility and we had a thorough interrogation as to what went wrong. And I mean, we're talking about 52 million Kenyans, but she came to that. She was a female minister that time. She came to the facility and we had to have an audit. What happened? And do you know, the simplest of things was that our anesthesia machine had a problem.
Wow.
And it was replaced the same day.
Wow.
Yeah. So it is possible. I mean, and she had this, no mother should die giving birth. You're a healthy person. The only thing you have is a child. We know how to deliver children. We know what are the risks. We know how to intervene on these risks. And one thing she mentioned, you know, that access to even emergency care, cesarean sections, that's such a critical one. That access to going back to theater if you're bleeding.
Yeah.
We have small innovations that we had even in this country, where we had innovated a catheter that can actually stop the bleeding for mothers. And it was being sold in health centers and facilities down, so that by the time you get to a higher level, we've already saved you, we've stabilized you. You're able to then go get the critical care you need. So I cannot overemphasize what Togo has said, especially for us who are mothers, and we've been part of that risk profile. You tend to know and believe that it's doable. Yeah. And pushing for it is one thing that we actually should. And when we look at societies, I mean, most people credit a lot to their mothers. So mothers should not honestly die during childbirth. Yeah.
All right. One of the things that I've, as I listen to you both, is one, healthcare is a sector that has a lot of partnerships. You know, whether it's government, whether it's private sector, whether it's philanthropies, whether it's private or, government philanthropic units. And how can that partnership be better? What are some of the things that we can do in the different spaces that you serve, to make these partnerships work for the continent? Togo.
I think it's just recognizing the contribution of each of those partners and what role each plays. Because really, it's like it's a whole jigsaw. Everybody plays a unique part, but all together it forms this beautiful finished piece. Governments are responsible for policies. And so when there is a new innovation that one of the things that I want to say, the Gates Foundation, we pay for research and development. Many people don't put money into R&D. But when you've paid for R&D, you've got a new tool. It can't just end up in a health facility without an enabling policy that says, great, this is life-saving. We're going to put this into policy. It's going to be part of our basic package of care. We're going to put it out there and a woman in Makweni is going to access it. It takes everybody basically doing their part and working together towards a common vision and a common goal. So that for me is where it all begins. The Sustainable Development Goals gave us that. They gave us the common vision. So we already have that. We are in agreement that these are the things that we want to do for humanity. And then the second thing is, once you have committed, stick with it. Just do it. That's all I'm going to say. Just do it.
I love that. Catherine.
We've come a long way when it comes to partnerships in the health sector. We started off with the West dictating what they thought was the need in Africa. And what I mean by that is interventions that they think will work. And we are now strongly in the space where we are able to voice as communities, as countries, by the way, this is our need. This works for us. This one you're saying, maybe it might work somewhere else, but not for this specific context. So we've come a long way. And again, let's give credit to where it's due. The space is now in some way very organized, that we are then looking, if you're looking at Kenya, you're looking at it as a specific country, not Africa. Some of these interventions that she's mentioned, they look great. They work in some places, but not necessarily with our context.
Africa is not a country.
Africa is not a country.
Yeah.
And even with tech and digital, we need to be very cognizant of the populations we do have. And the cost sometimes of even delivering that tech and digital and scaling it up. I say this because even something as basic as cost of internet bundles is such a big disparity in Africa. We have some countries reaching $16 for 1 MB. So even as we then curate these partnerships, curate these interventions, and scale what is working, we must admit that it needs to be very contextualized. It needs to look at where the grave problem is, where we can get the biggest bang for the buck. Yeah, that for me is critical. And so even for governments to then organize themselves and say, hey, we know we have this challenge and this is how we are thinking around it. How are you thinking around it? Okay, let's have these conversations. So now we have conversations, and it's been amazing to watch being in that space, the growth that has brought and the gains. So as Thoko said, it's everyone has a place, including private sector.
Yeah.
And so it is then collaborating with that common goal and saying, okay, this is something we want to invest in. This is worth all our time, money, and effort to protect. Yeah.
So as we wrap this conversation, what is the one thing that is your takeaway? You know, for somebody who has watched the conversation, somebody maybe who's not in healthcare, but they're just wondering, you know, what can I do? Or somebody in government, or you know, a global player in a sector that could impact or, you know, add something positive to the progress so far made. What's the one thing you're leaving this conversation with for our audience?
I think for me, what I'm leaving with the audience is we have made incredible progress so far. We have managed collectively to save more lives, and we just can't stop at almost. Every child deserves to live to their 5th birthday. Every mom deserves to survive a childbirth. If you can contribute to the conversation, if you're listening, you're a young person, your father works in politics, ask them what they're doing, ask them what they think about this. If you know somebody who works in agriculture is a sector. We're all farmers around here. Pretty much everybody owns a shamba, I've learned, in Kenya, and they grow food. What is the contribution of the agricultural sector in nutrition to save more lives? Everybody has something to contribute, whether it's your voice, and we need everybody's voice more than anything. And I think we just need to use your voice for good and use your voice to encourage action on things that we are all in agreement over. And we are in agreement that more children need to survive and more moms need to live.
Thank you, Thoko. Catherine.
It's hard to come after you. Similar sentiment. Again, no mother should die giving birth. Children should survive. And as she mentioned, that multi-sectoral collaboration towards this common goal is critical for all of us. And so as a human being, health is important. And so how do we then continue sustaining that push towards better health choices by governments, better resourcing, and largely having that collective accountability. You can do something, I can do something. We all have an opportunity to contribute to this cause. So let us.
Wow, absolutely. Thank you so much. Oh my goodness, this has been an amazing conversation. I have learned so much, including, Thoko, you've planted something in my mind on the role of Africa and the role of Africans in the global solidarity conversation. So of course, at that point, my heart was, how dare we think, or demand so much of somebody else's pocket? But on the flip side, we should. We have done so much. Africans are practically the engine of the global economy in so many ways. So I stand taught, and that, and I've learned so much in this conversation, and I'm so thankful that you've both made it, because it is conversations like this that begin to make a difference. It might be in our own little small space, but it will make a difference. So thank you both so much.
Thank
for
you.
having us.
And thank you to you, our audience, for being part of this conversation. You have been watching Pulse and Progress. This is a podcast that looks at real stories, focusing on bold solutions from the African continent. And as as my guests have mentioned, we all have a role to play. It may be little, but please play that role. So thank you so much for watching. We'll see you on the next podcast.